Hello, everybody. Welcome to today's panel organized by HTEC Group entitled Strong Tech for Powerful Women. I hope everybody is having a fantastic International Women's Day. As I see a lot of people are still joining us, we'll wait for another minute or two to get started so that everybody is here with us. Thank you for joining. Once again, welcome everybody. For the sake of time, I want to get started and more people will be joining us in the next couple of minutes. Thank you so much for joining today's panel discussion. Again, the title is Strong Tech for Powerful Women, but really what we wanted to talk today with our fantastic panelists is how technology can improve women's health outcomes, what is the current status of technology with regards to women's health, and what more we can all do together. Based on some estimates, the entire industry focused on women's health, and I think femtech is the general term used, whether you like the term or not. But the general industry will grow to reach over $60 billion by 2027. There is a huge need for technologies, and I think the pandemic has only escalated this need for technologies to be brought to women. And the current situation is that still most of these technologies are both conceived, designed, and marketed by men, which creates a lot of issues. Currently, out of all the investments in the health tech sector in the US, only 3% of these investments are focused on companies that deal exclusively with women's health issues. The rest are either general or men's health issues. So I think there's a lot of interesting things we can discuss today. I'm very excited to have an amazing panel of women joining me today, and I would like to thank them all for the opportunity to talk about this topic with all of you, and again to thank everybody who is joining our discussion today. To introduce our panelists, we have with us today Ann Holder, who is a dear friend of HTEC Group and the CEO and founder of Marani Health. Marani Health is a medtech startup out of Minneapolis, and Ann has been very passionate about the issues of women's health. Her company is developing wearable medical devices for monitoring key parameters during pregnancy, and I'm very excited to talk to her about how this is going and what she has planned in the future. Also with us today is Sarah Hess. Sarah is a public health expert who works in the emergencies program of the World Health Organization. Her career has been in international public health, and she's very much focused on policies around the epidemic and pandemic preparedness and response. And I think a lot has changed over the last 2 years in how we look at women's health, and there's a lot we can learn from Sarah and how her team has responded to these issues. Also with us today is Grace Hahn. Grace is an investor at Brighton Park Capital. She is working with Brighton Park portfolio companies on their value creation. And Brighton Park is an investment firm that focuses in the tech sector. And I'm really much looking forward to hearing how investors are looking at the medical technology startups and what are their priorities when investing in companies in this area. Finally, our last panelist that I am very excited to announce is Tina Purnat. Tina, who is joining us also from the World Health Organization, started her career in academia. She's an expert in health information, and she has worked both in academia, the European Union, and the World Health Organization for more than 20 years on research analysis and policy making. So again, a warm welcome to our panelists today. And and thank you to everybody who's joining us. Looking at the registration, we have people who have joined us from all across the globe, and I'm very excited to see that today with us are a lot of students from the Southeast Europe region, and hopefully we can give you some ideas for the future in this discussion. Sarah, I would like to start the discussion with you. You have been part of the epidemic and pandemic preparedness and response team. I'm sure the last 2 years have been both difficult, challenging, but also a lot has been learned over the last 2 years. We have witnessed how technology has shaped our response to the pandemic, both in positive and negative ways, if I can say. What are some of the key lessons learned for you and your team over the last 2 years? And what have you done to kind of use technology for better responses to the pandemic?
Thanks, Katarina, and welcome to everybody. It's really a pleasure to be here today on this panel. So yes, it has been a hectic 2 years to say the least, but not just for us, I think for everybody around the world. And I think it's been very obvious that there have been huge advancements in technology. And I think there've been, many estimates and studies done that have stated that the pandemic has actually sped up digital transformation and the adoption of new technologies by years, actually. So, and I think, what we've seen at WHO, at least, is that this increase in technology and digital adoption has been at all levels and within all sectors, not just in the health sector. So we're talking individual level, at an organization level, but then also at a sector or industry level. I think, more broadly speaking, in terms of the pandemic response, there have been some of the biggest advances in the biotechnology space, which I think everybody has followed, particularly in terms of vaccine development and the new mRNA vaccine technologies that were licensed for the first time during the pandemic. There's also been, huge advances in terms of genomic sequencing, which allows us to monitor these variants that emerge across the world. But I think, probably the most ubiquitous of all these technology advancements has been in the realm of this virtual communication space. We've all had to, in one way or another, adapt to this remote working scenario, and there's been a huge abundance of these video conferencing tools and applications to support collaboration. And WHO has benefited, I think, enormously from this because we're an organization that develops global guidance. And to do this, we rely on large global networks of experts around the world. And normally we'd fly everybody at great expense to Geneva and have a conversation. But we've been able to do this virtually, which has been, a huge advantage in that space of innovation and collaboration. But of course, I think for everybody, we've noticed the downsides of this as well. We lose that human element. It's not easy to build trust in this virtual space. It's easier for miscommunication and misunderstanding to happen. And I think this leads very much into the work that Tina and I have been doing during the course of the pandemic, which has been working in this space of infodemic management. So when I'm sure everybody's heard about infodemic management, and if you've not, we're happy to post some links in the chat to direct you to more resources and background. But the infodemic really refers to that huge abundance of information that normally accompanies a high impact of a health event like an epidemic or a pandemic, and it's a difficult time to navigate that information space and find information that's relevant and actionable. So when we started the work in early 2020, our premise was really to ensure that people everywhere had access to the right information in the right format in order to make decisions to protect their health. So really, that's about timely access to information, which this virtual space makes easy. But at the same time, the right information, it needs to be accurate. It needs to be context specific. It needs to be relevant to your situation, actionable. It also needs to be related to what, the information that people are seeking and asking. And what we've tried to do is understand where in this big information ecosystem we can reach people with this type of right information so that they can make appropriate decisions to protect their health. And I think, you know, to put that gender lens on it is a really important thing. We've seen throughout the pandemic an increase in gender-based violence. We've also there's been a lot of documentation also about the large proportion of the health workforce being women. And also when you go down to a community level, often women are the ones who are leading these informal or formal community networks. And so when we talk about an information ecosystem and making sure that we are feeding that information ecosystem and connecting with people who are trusted within communities to deliver information, we see women as really a really critical component and partner in that space. I don't want to go on too much, but I think that's just kind of gives a taster, and I think we'll have more time for discussion later on. So thanks very much for the opportunity to be on this panel.
Thank you very much, Sarah. You've raised a number of important issues. And like you said, women are often the ones who are making the decisions for their families and their environment and communities when it comes to health, or implementing these decisions as well. And getting the right information to them is critical for the overall population outcomes. So I'm very glad that this is the approach you guys are taking. I wanted to ask Anne, welcome Anne, and thank you for joining us today. I wanted to ask you, you've been really passionate about women's health for the last, throughout your career. And our team has been very fortunate to be able to work with you on a technology that's meant to bring CTG monitoring to women's homes. I really wanted to find out a little bit about your motivation behind this. What is the story and what lies behind your passion for bringing technology to improve women's health?
Yeah, well, and thank you for having me. It is pretty amazing to be here with all these amazing women. So I really appreciate it. A little bit about my story. I have an engineering background, spent time in engineering and operations and finance, and got into the healthcare sector and worked for years in a very large medical device company. But I spent most of my time in cardiology. And that really led into chronic disease management and then diabetes. And I was really looking at how to develop technology and bring technology to people that need technology in a more population health type of a platform. And at one point, Dr. Paul Friedman, who's the chair of cardiology at Mayo Clinic, came to me and he said, I think we need to do something for fetal monitoring, and we really need to start looking at women's health. And I was like, I don't know anything about fetal monitoring. And he really wanted me to work with the Mayo team, their engineers, OBGYNs, and cardiologists. And so I needed to do some research. And quite honestly, as a mother of 4, I was embarrassed and frustrated and angry that there had been little to no investment in prenatal care and technology. The technology that's used today in CTG was developed in World War I and World War II and put into CTG technology in the 1960s. And that is the technology that we're using today. And for me, I just became extremely passionate about this and really driven to help develop some technology that was inexpensive, easy to use, could be used in the home and in labor delivery, but would give, and going back to what Sarah was saying too, this is all about creating usable information that is really important at that time of care when the patient needs the care. We can't just blanket clinical teams with information that's not useful. It has to be useful and it has to be pertinent at the time when it's needed. So we initially started looking at labor and delivery and giving physicians much better information around the status of the fetus and oxygen, trying to prevent C-sections, trying to prevent oxygen-related injuries. But the device we were using developing in our prototypes, we were going to maternal fetal medicine specialists that really deal with high-risk pregnancies, and they were really passionate about using it in the home. And my background with chronic disease management is remote monitoring and utilizing technology in the home and taking it to the home. And so what we ended up doing with COVID, and again, back to what Sarah was saying, COVID very much accelerated the acceptance of remote monitoring in areas where they weren't used to using it in the past. And we very quickly pivoted our strategy so that we could get this technology in the home. So that's what we are really focused on right now. We're focused on bringing technology to the home so that women can actually collect their biometrics, get them to their clinical care team, and do it from remote locations, from locations that, they could be in rural locations too, but just don't have access to care. So for us, it's all about creating technology with pertinent, usable information at the point of time when it's most important.
Thank you, Anne. If I can just follow up on that, when it comes to remote monitoring, what are some of the challenges in implementing remote monitoring solutions? Are they technology related? Are they related to getting doctors on board with these types of solutions? Are there any implementation or scalability challenges that you face?
And I have done telehealth implementations before in my past. Probably the biggest challenge is not so much with the technology. It's not so much the patients using the technology at home. The biggest challenge, and where you have to have a very successful implementation, is change management within the clinic. It's working with the clinical team that's on site, and from an operational perspective, understand the patient flow, and you need to do that right so that everybody really understands how that process needs to change. That is probably the biggest challenge. It's not necessarily the technology piece. It's not really getting the patients to utilize the technology. In fact, with our technology, they want to use it more than what is actually even prescribed. And when the physicians want to see the information, it is really more just an operational implementation. So you have to do a very good job up front in implementing the program.
Thank you so much, Anne. Tina, I wanted to ask you, we've heard a little bit about Anne's experience within the Mayo Clinic and how this technology came to happen from working with the Mayo Clinic. As part of the World Health Organization, you've been very active in working with universities and research institutions on not just shining the light on new research that is relevant for public health outcomes, but also working with them to come up with new solutions and kind of scalable, innovative solutions for public health. I just wanted to ask you, in the last couple of years, have there been any technologies that stood out for you, especially when it comes to women's health, that have maybe come out of the research sector and have been successfully implemented, or come out of the World Health Organization policymakers or the private sector as well?
Yes, that's a good question. So let me give you some context on where the challenges are, and then I'll provide you some examples from the digital health field more broadly, and where we at WHO have been innovating and collaborating with researchers, especially the last 2 years. More broadly, from the digital transformation and how digital transformation has affected public health sector, I can basically, and I think you can see this also in your own work, the digital transformation has really affected all of the sectors of government, not just society, but all of the government sectors. But in the health sector, the innovation has been a bit uneven, especially when it comes to leading to and driving and leveraging technology and all of the digital benefits related to drive public health, people's health and well-being. So at WHO, there's been quite a lot of activities the last couple of years related specifically in trying to channel, well, where are the gaps? Why aren't we actually matching the innovation necessarily closely and getting it adopted, not only for healthcare provision, but also for public health purposes. And this is really difficult because health authorities operate in a different role in countries compared to, for example, even health service providers, and think more at the scale of how to promote public health in vulnerable groups, at-risk groups, etc. So where we at WHO have been partnering both with policymakers and researchers is actually ensuring to make it clear what are the practices, what are the types of evidence, documentation, and standards that one needs when you're using digital health interventions for public health benefits. Any public health practice, any public health intervention, any public health tool must be evidence-based. And we need to continuously evaluate it and also continuously understand how its adoption and use is affecting not only health outcomes, but also populations that it serves. Here's an example of one project that has been successfully partnered across many different global public health stakeholders, where a variety of national public health authorities, academia, World Health Organization, several global public health donors have come together to develop or are developing medical devices specifically to facilitate screening of women in low and middle income countries for cervical cancer, for example. This is, for example, one disease that is extremely high burden in low and middle income countries, introducing and developing devices that are portable, that are effective, and that are deployable and usable in a low and middle income country with certain specific operational settings. It's really key to do this, and I can share information about this as well. And this actually brings me to the second point, which is more within the scope of what Sarah also was mentioning, related to infodemic management specifically, or where we've been actually taking the same principles of asking questions: what are scalable approaches to responding also to this new societal, really major public health challenge, which is the infodemic. We've really seen the last 2 years that perhaps things that to someone that works in technology, it wasn't necessarily a surprise to us that the digital transformation has really changed not only communication among us, but actually really how our societies work. And that, health information and information ecosystem within which we live and we've become have become even more important for public health, but they're challenging public health. And this is not just a matter of electronic health records anymore. This is all really about how our societies have changed, where we have multiple digitized identities, digital identities, how digital environments are designed for use, for us to react emotionally to use products, or how we provide personal user experience, including patient-centered care, for example, in health. So we've seen this challenge over the course of the pandemic, where especially also in the health information and space, where when there's a mix of confusion, there's changing guidance, people feeling overwhelmed, frustration, they're receiving misinformation, and information is traveling faster across the world than any health authority in a country can actually react to it or communicate in what context the epidemic is being managed, or pandemic is being managed in their communities and in their country. So this has really challenged how we can collectively emerge out of the pandemic and how effective health authority recommendations and epidemic management interventions are. So I myself have a background in social science and biomedical informatics, and I actually was teamed up at the beginning of the pandemic with actually a multidisciplinary team of colleagues. We came from all kinds of backgrounds: public health, clinical practice, health communicators, risk communicators, people that have worked in community engagement, designers, you name it. And what we really found is that especially in responding to such a really serious, not just a public health challenge, but a societal challenge, those lessons or principles that in digital health or in software development or in digital public health we have been using, those needed to be really quickly applied also in how we think about solutions for to solve and address public health challenges from the infodemic. Perhaps so from the scalability point of view, for example, it's really important that we keep in mind that software development, that actually one needs to have a perspective that it comes from both perspectives, from software development and usability and user experience of the product, but actually also the public health context. So for example, we're innovating, working with academia and private sector on a conversational chatbot and asking questions, not what it needs to do. We're not developing a product itself, but actually how can it be developed to be effective in people practicing their skills in speaking, for example, to a family member that may have different views on COVID vaccines. And how can this be a digital intervention, evidence-based intervention that can be adapted in different contexts? Characters can be adapted culturally, attitudinally, etc. And how in a gamified approach, and how this is actually defined as a public health digital intervention that can be scaled into different communities, into different communication channels, into different online and offline communities, and in different countries, in different settings. So for us, it really matters these considerations of not only product development, but really scalability. And of course, in order to achieve this, the interdisciplinarity of a team is key. And also another concept that is more new to public health, but maybe not so new with, to colleagues that have worked in computer science before, which is human-centered design. Human-centered design approaches have grown out of software development actually for decades, but have only recently been really starting to gain traction in design of public health interventions. And through, for example, the fact that the response to infodemic is such a multidisciplinary nut to crack, we've actually introduced human-centered design approaches to also intervention design in this space. So these types of skills, multidisciplinary skills, are actually very important for us to have and for our future colleagues to have.
Thank you so much, Tina. I think the topic of multidisciplinarity, which is needed for developing these types of solutions, is a critical one that you've raised, and I'd like to hear later on the other panelists' views on this topic. We have a very multidisciplinary audience with us today, and I'm sure they'll appreciate a lot of the things you mentioned, especially on human-centric design and how that affects designing new software solutions for public health outcomes. Finally, I just wanted to ask Grace, who has joined us as well today as our panelist. We've heard kind of the private sector perspective, the public health perspective. I really also wanted to get a view on the investor's perspective. I mentioned in the beginning that a very small amount in general of investment is going to medical solutions that are focused primarily on women's health outcomes. But I think it would be really useful for everybody who is listening to us today, especially if they're developing their own technology solutions, if they're startup founders or working in technology companies. What do you as an investor look at when you're investing in the medtech space? What are some of the main considerations when observing these companies?
Yeah, happy to. Also, thanks for having me here today. So I would say there are really two key things that we always look for. And the first one is something that the other panelists have also already touched on today, but improving clinical outcomes. This usually means boosting clinical engagement and making sure that you're getting the people that you're trying to serve with your product to be more engaged with their healthcare professionals is super, super key. So I'd say that is definitely the number one most important thing that we look at. I'd say the product that Anne has created is a perfect example of this, of you're boosting clinical outcomes for pregnant women by giving doctors more visibility into the health of the fetus. I'd say the other piece that we look at is reducing costs, and boosting clinical outcomes as well as reducing costs go hand in hand, because if you're able to, you're creating a tool that decreases the cost of delivering these healthcare services to people. As a result, there's more money left over to then spend on improving the outcomes for their patients. And it's kind of like this flywheel effect. You are decreasing the cost that it takes to provide care to your patients. That gives you more money to then spend on other services to improve the patient experience, and around it goes. And so one company that we've invested in at Brighton Park that specifically addresses this is this company called Relation, and Relation is a patient engagement platform. And so what this means is they make it easier for doctors to get in contact with their patients, whether that's by two-way chats with patients in HIPAA compliant ways, or making it easy for patients to schedule their own appointments themselves. To bring everything back to the women's health focus, Relation works with a lot of OBGYNs to make it easier for these doctors to connect with their patients, for these patients to schedule their own appointments. And I'd say overall, whether it's Relation or Marani with what the product Anne's created, I'd say all of these solutions are they're making it easier for women to gain access to the healthcare that they need, and just overall boosting the awareness about the importance of women's health, and how technology can really make it much easier for women to have better health outcomes.
Thank you so much, Grace. Thank you, everybody. I just want to say to everybody who's listening to us today to feel free to leave your questions in the chat or raise your hand if you'd like. I really want you guys to have as much opportunity to ask our fantastic panelists question. So feel free to, as we chat along, to start asking your questions, and we'll try to address them all. I wanted to follow up on what Tina said on multidisciplinarity, and I really wanted to ask Anne in particular, when developing your product, the Marani team, and working with the Mayo Clinic and everybody who's involved, who have been some of the key actors? What are some of the important profiles that were needed to come together into one team to develop this type of technology? You're muted, Anne, sorry.
Sorry about that. You know, quite honestly, the team is actually pretty extraordinary. I mean, if you look at the technology team alone, on the technology side, it's the software developers, and with many different skill sets. It's machine learning engineers. It's the people that understand human factors, you know, because when you're looking for CE mark and FDA approval, regulatory approval, it really is all about usability and making sure that people understand how to use it. It's easy to use. And then also looking and working with many clinicians. So clinicians that are more general OBs, and how are they taking care of their low risk patients, but maybe in rural areas? How are they taking care of high risk patients, both in rural and urban areas? So working with a lot of the clinical folks as well, nurse midwives, doulas, getting a lot of feedback to understand, what is it that the mothers want to see in the home, the information that they want to see, the information that the clinical teams want them to see, but what may be different on the clinical side as well. So we've worked with a very large number of people to make sure that as we're designing this from a usability perspective, that it works for patients and it works for the care team as well.
Thank you, Anne. Tina, I wanted to follow up with you very briefly on something you mentioned. And I just remembered for everybody, Tina worked on a very super interesting, I wouldn't call it policy document, but it's more guidelines for people who are developing medical devices, be it in the private sector or in research institutions. And it's focused on guidelines how to use AI when developing medical devices. If you can share that in the chat, I think we have a lot of people I know on this call who would find this type of guidelines super interesting. But in the meantime, I wanted to ask you, Tina, we mentioned a little bit about this kind of disproportionate effect of the pandemic on women. And I think it relates to, and especially on women's health, I think it relates to, all types of health outcomes, be it mental health, be it physical health, everything. Do you think, have you seen working with all these different stakeholders that are trying to respond to the pandemic, do you see enough awareness on this disproportionate effect? And do you see enough work on solutions that are really tailored to women?
We could do better. But thank you for asking. It's really important question. So yes, I mean, during the pandemic, especially the health systems have been overburdened in the time of COVID-19, and they've been particularly stressed and overloaded in the occupations that are majority female. So, for example, in the health system, that's nursing staff. So, households and women, Sarah mentioned this before, and you did as well. Households and women are usually responsible for health and well-being of their family members and in the broader community. So they're also then responsible to adhere to public health guidance, things like wearing a mask or cleaning surfaces. So they put themselves disproportionately at risk of getting COVID. There's also economic impacts of COVID-19. They've meant that women may have taken a step back to provide for their families. So they've taken a step back in their careers, especially if children are not going back to in-person schooling. There's also this aspect of going virtual in the workplace. It's meant that women early in their careers, they may not have had the same mentorship and networking opportunities from their bosses, which is actually crucial in the early career development, especially of women. So really, it's a complex issue. So when you're, yes, I don't think there is a comprehensive awareness of how much actually women in many different aspects of our lives have been affected and challenged with the pandemic, with things that perhaps will actually reverberate through society and in women's health and well-being for much longer than the duration of the pandemic itself. So we do see some actions being taken policy-wise. So, for example, more employers are recognizing the need for flexible work policies, and more resources are being dedicated to the real mental health needs and work-life balance needs of people in medical occupations, especially those occupations that are heavily female. But there's lots that still needs to be done in a systematic way, really recognizing and understanding what the challenges are and how to address them.
Thank you so much, Tina. Grace, I wanted to ask you, I don't know how much you can disclose about your pipeline and what's happening, but maybe from just looking at the space at the moment, the health tech and femtech space in general, do you see any kind of exciting new things happening? Is there, do you see that the last 2 years have really brought a focus on the space, a lot of new technologies, a lot of interesting companies coming up?
Yeah, I'd say one area that I find particularly interesting are platforms that make it easier for people to get medicine. I think specifically for women, it's access to birth control. There are all of these, at least in the US, rules and restrictions around how you can access medication. And I think COVID in particularly brought a lot of light to how big of an issue this truly is, when people were stuck in their homes and couldn't go see doctors, and then as a result couldn't get scripts renewed. It made it really difficult for people, specifically women, to get access to the medication that they needed. So we think we're seeing a lot of platforms pop up in the market that either bring this medication directly to the end customer, or just overall make it easier to have those doctor's appointments, whether it's virtually with your physician, so you can get that script for that medication. So we think tools that make it easier to bring medication to the end customer in a much more streamlined way is pretty cool.
Great. Thank you so much, Grace. I wanted to just mention that kind of one of the motivations for having this discussion today is the fact that we will invite students from all across Southeast Europe to join us towards the end of March for 2 days to work together with the HTEC engineers and designers and other experts on developing their own kind of ideas for how technology can improve women's health outcomes. And our panelists from today have been very kind to rejoin us again on March 24th when these teams of students will be pitching their ideas and will be working with them to develop them further. As we wait, again, I want to mention that you can feel free to leave your questions in the chat and raise your hand if you'd like to talk as well. But in the meantime, since I know there's a lot of students listening to us today, there's also a lot of engineers, product owners, product designers, and very different profiles. Like I mentioned, a very multidisciplinary audience with us today. I wanted to ask all our panelists for some advice for the students who will be working on these solutions towards the end of March. So kind of from your perspective, if you had the challenge of working for 2 days to come up with a new idea on how technology can address one particular woman's health issue, what kind of health issues would you look at first of all? And then what kind of technologies would you focus on to deliver some solutions? Would you care about the business model that sits behind this idea? Would you care about the scalability? What are some of the key things that you would think about if given 2 days to kind of come up with a new idea? And Sarah, maybe you can start us off with some advice.
Okay, great. Thank you. I mean, I think there's so many health issues that could be addressed that are particularly interesting, going from very broad subjects like what Grace, you mentioned, the reproductive health issues, but then very niche and specific as well. I mean, my advice really is to start with listening. I mean, what is the community of women that you're interested in providing for? Is it a global community? Is it more of a geographic community? Is it a community of women that's affected by a specific health issue? And putting into place that listening aspect. What is it is the actual barrier? Have you understood it accurately? Does it make sense? Is there a solution that comes out of that, but from that listening perspective? I think the other thing that I would highlight, and this is, I do quite a lot of work at a policy level, and when you come up with a solution and an idea, of course, it has to be appropriate and acceptable to the people that you're designing it for, right? But at the same time, and I think that Anne alluded to this, if you haven't written the business case for the policymakers or the people that are gatekeepers to the implementation of it, it's not going to fly and it's not going to succeed. So while you have to really have that end user perspective, you also have to have that perspective of how are we going to get this through the gatekeepers, and how are we going to get people to sign on, support, implement, disseminate it. And so much of that, I think, is about finding that, what we call at WHO, that coalition of the willing. So this is your group of allies that are passionate about what you're passionate, and are willing to go that extra mile for you. And often that can be female colleagues. So I would definitely put that out there. One last thing, and it's just because it's something that I'm particularly passionate about, is to just always be aware of the lower resource settings. And I think I was thinking about this while Grace was speaking about the platforms that bring medicines to people more easily, and particularly in the context of birth control and reproductive and sexual health. I mean, this is a subject area that particularly in Africa we've been talking about, you know, for decades in the context of HIV, and yet those innovations that would really make a difference to those women in those settings and those contexts, has there been the appropriate amount of investment and thought given into those, what would be feasible in those kind of settings? And I would just put that there as a kind of just think about it space. So that's it from me.
Thank you so much, Sarah. That's some fantastic advice. Anne?
Yeah, so as I think about it, you know, again, you know, with my background and then diving in so deep into women's health and really focusing, for me, my focus is the prenatal and postpartum period, you know, and we're looking not just at the biometrics of the fetus, but we're also looking at the biometrics of the mother. And in this space alone, there's just so much that you can do. And really looking at the social determinants of health and looking at mental health and how do we really help these mothers. So, I mean, I think there's just so much opportunity when you look outside of this period. And in my mind, I keep going to the next phase of life, you know, you know, I'm always thinking about, you know, the technology that's needed. And one area where I do think, and I scratch my head continuously, and again, frustration because of the lack of investment, the lack of innovation in women's health, it is very disheartening. And, you know, and I look at the perimenopause phase for women and menopause and what are we doing for women's health in general? So I just think there's so much opportunity for technology and advancement, and we are just scratching the surface right now.
Absolutely, and I read somewhere and left, you know, when somebody mentions women's, you know, women's health-related technology, everybody just thinks about period trackers, and that's the scope of it, you know. And the scope of the issues is so wide, and like you said, covers the whole lifespan and all the different health challenges that come in the different phases of life. So thank you for shining a light on that. Tina, what would your advice for our multidisciplinary teams of students be?
I would actually totally just do a +1 for what Sarah and said. You know, from point of view of when you're picking a solution or an idea or a challenge that you're trying to address, really define a focus of what is the challenge, what kind of impact do you actually hope to have, what do you try to, what kind of a health outcome or aspect of women's health and well-being in a particular community, at-risk population or patient population, etc., you are trying to address, and what the impact is going to be. So before you even start doing anything hands-on, make it very clear to yourself what you're trying to address, and then you start looking and involving both the community itself, together with your team, how you would actually solve this. And in 2 days, if you're successful in defining what the challenge is, why it matters, and how you would go about going through the next steps, and of course, human-centered design is all about really researching and involving the end users or the target community of focus in the solution design, that you can't do in 2 days, but describe what you actually and define what the population, what you're trying to solve, and why it matters, how much of a burden or a challenge, a health challenge that is. But otherwise, as far as the topics, I totally subscribe to what Sarah and Anna have said.
Thank you, Tina. Grace, I know it's very hard to go after all three of the previous panelists, but is there anything you would like to add in terms of advice for students who will be working on their own ideas to these challenges?
Yeah, I would say to add on to what everyone else has said, when you're thinking of the idea that you want to pitch and you're trying to come up with inspiration for that idea, think about either roadblocks you've come across in your life or roadblocks you've seen other people come across, because oftentimes the best inspiration for new product, new technology is an issue that you're personally passionate about. And so I think, and when you're going into an idea with passion, it just makes you more excited about what you're building. And it makes the people that you're, back to the point that Sarah was making about, you have to think of who's the person that is the gatekeeper for the success of your idea. And there's two stakeholders. There's regulation, and then there's the people who are funding these ideas. And if you don't have passion about what you're building, how are you going to get these other people to also have passion about what you're building? So that's not an idea of what to do, but maybe some ways about how you should feel about this idea that you're proposing when you're trying to ideate and think of what is this great idea that I want to propose in a couple of weeks.
I think that's fantastic advice. Thank you for that, Grace. And thanks for everybody for sharing their views. We have a couple of questions in the chat, and I would like to start with Dragana's question. Dragana's joining us from the University of Essex. She wanted to know if any of the panelists had either their own experiences or wanted to talk about digital advancements when it comes to addressing loneliness and social isolation, as these have been some of the issues found to have a negative impact either on physical health, such as cardiovascular, or mental health, such as depression. She also knows that some studies have found that social disconnection negatively impacts social connectedness, preventative health care, cancer screening, immunizations, and so on. So have any of you thought about these challenges or seen any interesting solutions?
So yeah, it's very interesting. I saw that question, and I actually had a call just this last week with one of the chief medical officers at United Health Group here in the United States. United Health Group is one of the largest payers in the US. And if you look at the US healthcare system, about 50% of the babies that are born in the US fall under what we call Medicaid, which is the government, and then the rest fall under the private payers. And what United Health Group has been doing is not only looking at social determinants of health. Do mothers have the food? Are they in a safe place? Do they have the care, transportation? What do they need to help with outcomes? But one of the things that I didn't realize, and there's been a recent study that just came out, is this whole idea of loneliness and disconnectedness. And they have found that the incidence of fetal mortality increases significantly with this whole idea of loneliness and being detached from people. And so one of the things that we are working on is trying to figure out, how do we do this? How do we understand where the mother is in her pregnancy, so that we can help in one way or another and get the right resources available for the mothers. But it was one of these things that I didn't really understand myself. I mean, we all know about mental health and depression, particularly with pregnancy, but being lonely and disconnected, and particularly during this time with COVID, has really led to some poor outcomes. And it's really staggering, the number of stillborn births here that we've been measuring due to COVID. So there is definitely something there. There needs to be a huge focus in this area, and more attention paid to it. And again, more technology to help understand who these women are and who needs help.
Thank you so much, Anne, for noting that. I really never thought of this, and it's a really, really shocking piece of information. Sarah or Tina, Sarah, would you like to also comment?
Thanks. Yeah, no, it's something that I've thought a huge amount about over the pandemic. And often when we think about a health system, we often don't extend that into thinking about the health and social system that is so critical in issues around what we're just talking about in terms of loneliness and connectedness and the impacts of that on your health and well-being. We had a conference at the end of last year where we were talking about spiritual care, actually, and we were talking to chaplains who were working in some major hospitals in both the US and in the UK, and the incredibly important role that they played just with an iPad, being able to visit patients in ICU and connect patients to their families via an iPad, and to sit with them and say the prayers that they wanted to say or read to them, and that very hidden but massively important role of keeping people connected. And when people came out of their comas and came out of ICU and recovered, how much that was an impactful and critical part of their recovery, that connectedness with somebody that they didn't even know, but who took the time and the energy to be there and to make that connection with them and their family. And I think, just as Anne said, there needs to be a huge amount more attention paid to this role of social connection in health and well-being, and I would vote for anything that was to do with that.
Thank you, Sarah. Unfortunately, I'm sure most of us have experienced this feeling of just pure tragedy and feeling helpless in a situation where you cannot visit and be with your loved ones while they're sick. It's great that you mentioned that technology can, in some ways, at least slightly improve this sense of loneliness when being in hospital or not being able to visit the people you love. Thank you so much for mentioning that. We have also a question from Milena, who's thanking all our panelists about experimental therapy. Are there any predictions regarding it, since COVID has slowed down the trials, and can technologies help in some way? Anybody, Tina, any comments on this, perhaps?
So I'm not a specialist in clinical research. I left the field about 10 years ago. But what we've seen in the, for example, in the COVID-19 research, both in development of the vaccines, but also the treatment and diagnostics, is that there's definitely a need to innovate and think through how research data is collected, shared, how studies are done and exchanged in a way that that actually contributes to very rapid decision making collectively. So distributed research frameworks. It's a very difficult question to answer, because this is not only about research, it's actually about policies regarding ethics. It's related very tightly to regulation and later to moving any treatments into clinical use, etc. So that's a very complex topic, and I would advise. I can research a little bit more and talk to colleagues at WHO to perhaps come up with some resources for Milena, if you're interested in this, to actually maybe even connect you to people that work at WHO that know a little bit more about this. It's we definitely have seen that technology itself, both in data sharing as well as analytics, and a lot of innovations in production have made a huge difference in this space during COVID-19. We actually at really record level, really record pace, got to the point of multiple vaccines, specifically because of major innovation in technology, in the whole development process of immunizations, for example.
Thank you very much, Tina, and thank you for offering to send additional resources. Milena, if you'd like, please get in touch with me or directly with Tina. Thank you for everybody who listened to us today. We will today announce on our websites and other channels the application form, and we would really like to see a lot of women students of different fields, not just engineering fields and life sciences, but also design and business apply to be part of this two-day idea marathon, which will happen on March 23rd and 24th. And I'd also like to give a huge thanks to all of my colleagues at HTEC who have already applied to be mentors and work for 2 days with students on coming up with some innovative solutions. I think today we had a lot of inspiration from our great panelists, a lot of great ideas to think about, and I would like to also thank them that they'll join us again on March 24th to hear the ideas that the teams will come up with. So if you can't join me in thanking our panelists, and see you all on March 24th. Bye, everybody. Thanks for joining in.